So today we're going to be going over different things about the AED. First things first, we're looking for any unconscious athlete. First of all, the reason we would use this is for if you saw an athlete that has cardiac arrest or electrical arrhythmia of the heart. At that point, if you see an unconscious athlete or see like someone just like unconscious outside the clinic, what you would do is look for unconsciousness. So you tap them on the shoulder, hey, obviously unconscious right here, not responding. So at that point, you would I would look for a bystander or some other trainer that's near you or any other admin and tell them to grab the AED and call 911. Because you'd be looking for any breathing, any pulse, any abnormalities like that. So you would tilt their head back, listening for breathing, looking for the chest to go up and down, as well as the pulse as you're checking. There's no pulse here, so at this point I would have someone call 911, grab the AED, and at that point I would begin CPR. 30 chest compressions with 2 rescue breaths, about 5 cycles or so, until I assess again, looking for pulse, looking for respirations, anything like that. Before I grab the AED and start, I'm looking for, if it's someone under 2 years of age, I wouldn't use the AED, just CPR and rescue breaths. Looking for a pacemaker, because they have a pacemaker, they're already trying to regulate their own heartbeat. It's already its own defibrillator, so would use it for that. Any metal, and if there was a young toddler or some kind of way I couldn't put the pads on the way it's shown, I would even try and use a top to bottom, so encasing that heart, one on the top, one on the back. And so at this point, my imaginary person got the AED, so I would begin by hitting the power button.
Remove clothing from
obviously at this point I should already be removing clothing by the time I ask for the AED. Once I ask for that AED, I should be removing that clothing, so that way I don't have to stop giving my CPR just for that. So begin the pads. Make sure I put them in that right spot. It's kind of dummy proof because it shows you right where you should be putting the pads at.
Onto patient's bare skin.
With that bare skin, if there's any wetness on, you want to dry it off with a towel or any kind of thing you can use to dry off the skin, make it easier for the AED to work. So this one shows right above, right on the ribs. So put it here, as well as the other one is right on the upper right chest. Okay, and then just listen to the direction of the AED, moving that clothing.
Open packet and apply pads onto patient's bare skin.
Upper right and lower left.
Apply pads as shown in the picture. Press pads firmly on skin.
Make sure that they're stuck onto there so they're reading that heart rhythm.
Apply pads as shown in the pictures. Apply pads as shown. Press pads firmly on skin. Do not touch the patient.
And right here, you don't touch them, because I analyze that heart rhythm. You don't want to change that heart rhythm at all.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch.
So at this point, if shock is advised, have everybody clear out of the way that you have aiding you. So shock is advised. Make sure everybody's out of the way, including me, and hit the shock.
Delivered.
Shock will be delivered right there.
CPR.
And then the AED even gives you a metronome, a little beat of when you should be giving your compressions. So right here, and also that should be 10 right there. Keep going to 30 with those 2 rescue breaths. So at this point, if the patient does regain consciousness, or there we go, regain consciousness, begins to start breathing again or shows a pulse, we would stop using the AED and just monitor the patient, make sure that none of the symptoms change. Wait for EMS to arrive. No matter what, even if they are conscious, they should be going to the hospital to check for maybe they have a possible irregular heartbeat that they don't know about. And we can get them to the doctor, get that checked out for future. So with that, we're good.